I'd like to invite to the stage Candace DeMatteis, who is the Policy Director at the Partnership to Fight Chronic Disease. Welcome to the stage, Candace.
Thanks, Ryan.
Now, I am so grateful that so many of you have come out early this morning. Alzheimer's is an issue close to my heart. I'm sure it is for many of you, given how prevalent it is out there in our communities. And we could not do events like this without partners like the Partnership. So I'm just really honored to be here chatting with you today, Candace. Now, chronic disease is the #1 cause of death, disability, rising healthcare costs. Can you please tell us about the Partnership and why you've decided to make Alzheimer's a specific priority?
Sure. Well, as you mentioned, chronic disease, it affects 1 in 2 U.S. adults. More and more children are affected by chronic disease, and a lot of that is preventable. We have interventions that also help to reduce the complications that drive costs and affect our quality of life and our length of life. So the Partnership is a broad coalition really focused in on that, as our name implies. So for Alzheimer's disease specifically, it is a devastating disease. It is so costly. It has impacts not only on the individual, but the family, the community, employers, and obviously the nation as a whole. There's so much unmet medical need. But as Joanne talked about, there's a lot of excitement, there's a lot of advancement. We know more than ever, and we're really starting to be able to make a difference. So that's why the focus there as well for PFCD, and me as well. You mentioned you're personally affected, so for me it's a professional interest, but I also have it in my family and am dealing with it presently with loved ones, so it's a personal passion as well.
And we heard some good news from Joanne in the previous conversation, progress. But what's your take on, what's the score when it comes to progress in both diagnosis and treatment?
So we just finished the World Series, which was fantastic for those of you who watched. So I like to use a baseball analogy. We're finally in the ball game. We're finally at bat, and we're getting base hits. Alzheimer's disease was first named and diagnosed, if you will, over 100 years ago. But it's only in recent years that we've actually had FDA-approved treatments that interrupt the progression of disease. We now have blood-based tests to allow us to detect it at a preclinical stage. And ideally, and there are clinical research ongoing to intervene at that early stage. And that's really where we're going to see big differences. Yeah. So I know some people are critical because they want that home run. It's, we're all eager for the cure, the thing that stops it in its tracks so we don't have to worry about it anymore. But it's so important to recognize how far we've come, the decades of experience that have led up to this, the billions of dollars that have been invested to get us to this pace, but that pace is accelerating and we are moving forward. So it's a really exciting time for Alzheimer's disease. We just need the policy, candidly, to keep pace with that.
Well, I'm honestly glad you mentioned that because we could get the silver bullet on the medical side, but there are still going to be barriers for both patients and caregivers. It's policy, it's how the individuals are aware and how they take responsibility for their own situation. What are some of the biggest barriers that patients and caregivers are facing that you want to see removed or reformed?
Well, the first one I would say is just getting rid of the idea that dementia and, it's like, oh, it's just forgetfulness, or that dementia is a normal part of aging. It is not normal. And so if we can get rid of that myth, then people can seek, like, hey, something's going on here. I've noticed something. Let me get checked out. Yeah. So that's the first major hurdle. And then the other is, we have shortages in the healthcare workforce. Joanne mentioned the ADAPT Act that would invest in the dementia care workforce to be able for people to have access to specialty care, but also at the primary care level to understand what we're looking at. And then there are also coverage gaps that are really important. People are diagnosed earlier. There's early onset Alzheimer's for people who aren't at Medicare age yet. There is legislation in the works that would accelerate the time from being diagnosed to being able to get Medicare coverage, which again would provide that access. So there are a lot of opportunities And unfortunately, those barriers need to be overcome so people can have early access and get diagnosed and treated.
And could you give us a sense, or if you even have specific numbers around sort of what are those delays between understanding there's a problem and getting treatment, or how many people are not getting access to the therapies that would really like halt or slow this at the early stage? Because, you know, let's be real, that's what would save a lot of pain and a lot of money if we could mobilize ourselves towards that sort of situation.
Sure, no, it's a great question. We know that today alone, 3,000 or more people will progress beyond the reach of these currently FDA-approved treatments. So they may have mild Alzheimer's disease, and if once you progress to moderate or even more advanced stages, these drugs aren't labeled for those advanced stages. So that's huge. So time is clearly important, but because of workforce barriers, because of stigma, because people, you know, don't accept that this isn't normal, any kind of delay like that delays the reach of these treatments and is really, really tragic. And then facing coverage barriers as well can be really difficult.
Yep. So, I mean, I look across this room, I know some of you are new to me, but it's a formidable audience. We've got advocates, we've got medical professionals, members of Congress even. So as you sort of think about that audience, what would you request their help on? What do each of us in this room need to think about, whether it is something aimed at HHS, at CMS, somewhere else? Like, what are the requests that you have for folks here?
Well, as I mentioned, the pace of innovation is really accelerating quickly. We need policy to keep pace. And a lot of that, we mentioned several bills, Joanne and I both mentioned the ADAPT Act, ASAP to make blood-based biomarkers more available in coverage under Medicare. We also have a coverage policy in Medicare that is limiting access. It was an unprecedented decision called coverage with evidence development, first time ever applied to not just to any FDA-approved drug for its intended and labeled use, but a whole class of medicines. So that precedent may affect future therapies as well. It requires, you're not covered unless you participate in a clinical study under Medicare, so that restricts access to.
But that's really hard for a lot of people.
It really is. I mean, I can give an example. My mother was diagnosed with Alzheimer's disease. For her, it's a 3-hour drive to get treatment. These infusions are, you know, one of them is once a week. She just decided, no, I can't do that. So to find a provider that was participating in the registry in the clinical study, and she lives near an urban area in North Carolina. So can you imagine if you're in Wyoming or, you know, somewhere that's even more rural? These are real issues that people are facing. And so as that paces, there's a lot of excitement, but we need that urgency. I mean, all of us are affected. If you don't have a personal loved one who's affected, I mean, we're all getting older, so our risk factors are going up. So we need that urgency to, from the Hill, to push back on the administration to get them moving, NIH funding, Medicare coverage, and the like. So there are really a lot of opportunities.
Yep, and a lot of work for everyone.
Yes.
To do. You kind of touched on it there, that this, in a sense, what we do with Alzheimer's can set a precedent for other conditions. Sort of, what's the best argument there that people should keep in mind? So even if you're not personally affected by Alzheimer's, why do we have to get this moving now to make sure that we can support other conditions going forward?
It's a great question because with that precedent that I was talking about with Medicare coverage, the coverage with evidence development, there are kind of a little bit of dubiousness in terms of whether CMS even has the legal authority. That has not been litigated yet, so stay tuned there. But there is an opportunity for Congress to step in and the administration to step in, Congress to push to reverse that policy and the administration to then reverse that policy. But where the challenge comes in is it would allow CMS, if they feel like they do have this authority, to do it to other treatments, to do it to all future Alzheimer's treatments, potentially, God forbid. But other neurological conditions, cancers, I mean, any number of different things. Yeah. The other thing that the CED did was cast a shadow over the FDA's accelerated approval pathway. And that accelerated approval is a pathway that is written into law. And it focuses on diseases that are serious, often fatal conditions for which there really are no or not very good treatment options for people. And it accelerates the access, patient access, and FDA approval. It doesn't change safety. Safety is still the same. It just uses a surrogate endpoint instead of the final endpoint, and clinical trials continue. But patients have access because they are living with very dangerous, serious diseases. CMS under the CED policy said if you want coverage under Medicare for that, an accelerated approval drug within this class, you have to participate in a clinical trial, which means literally you could be randomized to placebo. You're paying and you think you're getting treated and you're not. I mean, if you talk about you've got a fatal illness and you may be receiving a placebo, it's just untenable, really.
Yep.
So that's another area that we would like to see, Congress step up and say,
Yeah, and I mean, I hate to mention it because cost is often such an issue around healthcare issues, but one other untenable aspect is sometimes the cost, like $10K a month for ordinary care, $15K a month for memory care sometimes. How have you seen that changing over time? And is there anything in particular we need to keep in mind about those cost factors?
Absolutely, it's a great question. One thing that I think anyone who's lived with a loved one with Alzheimer's disease knows how expensive it is. And that's usually on you. That's on the family. That's on the individual until you spend down and qualify for Medicaid long-term care. As you mentioned, long-term care, regular long-term care is $10K a month. Memory care is 50% more than that, $15K in our experience, and in some parts of the country even more. So those are borne by, they tend to be borne right now outside the medical system. And anytime you have a new intervention, where before it was the family's taking care of the person and then they become more and more disabled and then pass, those costs are not within the healthcare system. So anytime you have an intervention that shifts to the healthcare system and people, it's too expensive, we can't afford it. Well, families have been dealing with it for decades. And so it's important to recognize that yes, cost is so important and it's critical to look at things. We want things to be accessible, we want things to be affordable. But when you're looking at the price that families and the cost that family caregivers and others are carrying, and a lot of uncompensated care as well, shifting that and being able to delay progression is so critically important and so valuable to those people.
Candace, thank you so much. You've given us a lot to think about. I believe in all of you. We all have the capacity to go and make some useful changes based on this information. Thank you, everyone, for listening, and thank you, Candace, for sharing that.
Thank you.
Welcoming back to the stage, Peter Sullivan.